My name's Nicole. I'm a new grad BSN and a new hire into public health. Today I'll be discussing clinical implications of candida and cleft lip for breastfeeding through the lens of the situated clinical decision-making framework. Firstly, the situated clinical decision-making framework is a nursing process that's centered around knowledge. So that's nursing knowledge in clinical practice and theory, experience, but also the client and the family's knowledge and experience and what their experiences, but also the nurse's intuition. So a center of knowledge whereby cues and nursing assessments occur and judgments are formed and goals are set and decisions are made and evaluations occur. So as a new grad, I've never encountered candida or cleft lip in my clinical practice. So I've gone ahead and done some research. Cleft lip occurs in 1 in 400 to 1 in 700 live births in Canada per year. So it's not uncommon. And it could involve, the soft and hard palate underneath or just the lip itself. So for today, we're only going to talk about the lip. So if you can imagine a break in the skin from the nair down to the lip on one or both sides. So it's an opening in the mouth, in the lips, I mean. So a model to describe this is a bottle cap. So where the underlying tissues of the bottle cap are not disturbed, just maybe a slit or two in the bottle cap. So if this spout and bottle are the mother's nipple and areola, it's not impossible in theory to get a seal and suction for latching, but it's not ideal as if it were complete. So there's not a reason to not breastfeed. Physically, psychologically, on the other hand, we'll discuss that later. So what are the underlying reasons for a cleft lip? It could be a family history. It could be maternal exposure to drugs, smoke, or alcohol in utero, or it could be neither of those. We don't necessarily know all the causes. Candida, on the other hand, is an overgrowth of the candida on the skin of the mother's breast or on the inside of the infant's mouth. That could be caused by maternal exposure to antibiotics during labor and delivery, for example, disrupting the normal flora of the skin. Could be as a result of poorly controlled blood sugar through diabetes, again, interrupting the normal flora of the skin. Could be an active yeast infection vaginally during delivery of the baby, and baby could pick that up on the mouth, give it back to mom on the breast, and so on. So what I found out is that neither of these are reasons, so candida or cleft lip, they're not reasons to not breastfeed, but it could be uncomfortable and challenging. So what are we looking for? At the breast, could be poor latch. Mom could be in a lot of pain. Baby could be pulling away and not interested. There could be white patches on the inside of the mouth that just don't wash away. Mom could have red, hot, itchy, painful nipples and breast tissue. It could escalate into mastitis if it goes untreated and the skin breaks down. And the infant could also have decreased weight gain or decreased output, so not frequent stools and urine, but also could have a diaper rash that does not resolve. So what kind of judgments can we make from this? So, we've got a difficulty in latching because of thrush and cleft lip, and we know that surgically we need to treat the cleft lip, but also we need to treat the underlying cause of candida. So I propose the following 3 goals. So we need to continue breastfeeding and overcome the challenges that are occurring by simultaneously treating the candida for both mother, baby, and partner, or anybody else involved, and also preparing for surgery. So that means making sure that the infant is ready for surgery, which usually occurs at 6 to 12 weeks. So in order to get these goals and meet these goals, we need to consult with the physician. So the physician and pharmacist will direct the pharmacological treatment of candida. So for the mom, it's usually a topical treatment before and after breastfeeding to prevent the continued growth of candida. and that can also be the case for the partner, but they may need an oral rinse. Baby will definitely need an oral rinse of nystatin or gentian violet, usually not gentian violet as the first line of defense. Nystatin is an oral rinse that's swished and swallowed or swabbed and swallowed for baby to hopefully clear the candida in the mouth and throat. So that's usually 4 times a day. Mom is before and after feedings, and partner is treated simultaneously so they don't just bring it back into the mix. So how do we know if that's working? So feedings are going to be going better. Less pain, less redness, decreased rash in the diaper for baby, and decreased white spots inside the mouth, and better transfer of milk, and better weight gain, better breastfeeding experience overall. In terms of treatment, we need to make sure that the treatment is completed. So not just stopped when the symptoms go away. It needs to be completed to the full course so that it doesn't come back, because it is one of those things that can come back and forth. If breast pumping supplies or bottles are being used, they need to be sterilized once a day so that it's not, again, being perpetually brought back into the mix. So that's the first goal, treat the candida. The second goal is to prepare for surgery. So this is twofold. Because the infant needs to be 6 to 12 weeks old, we know that at that time, baby will expect to normally double their weight at that point. That's not going to happen if breastfeeding is not going well. So we need to support the breastfeeding first. So what that might mean is, even though it's possible and not ideal, the infant might need steri strips or a specialized tape to secure the opening of the mouth that's incomplete, to facilitate a positive breastfeeding experience. Mom might also need some more support in finding breastfeeding, measures that are successful, so different positions and different approaches, and a lot of emotional reinforcement. Like, it's hard at the best of times, but when there's challenges, it's going to be even harder, but it's not impossible, and you can do this. Just a lot of positive self-talk. If baby's still not gaining, 4 to 8 ounces a week, doubling birth weight by 2 to 4 months, and having 5 to 10 stools a day and frequent clear urine throughout the day, then we need to up the feeds. So maybe instead of every 3 hours, every hour and a half, to make sure that baby's getting enough before considering supplementation with formula or donor milk. By doing that, we're prepping for surgery, because surgery can't occur if the birth weight isn't doubled and the infection isn't cleared. So from there, counseling the mom and supporting her through, at least in my health authority, there's a cleft lip and palate clinic in Victoria. So connecting her with, the speech language pathologist, the surgeon, the pediatrician, and all of the counseling that they offer through there to prepare for surgery. From there, mom might not be followed if she doesn't live in the area. She might be followed through infant development in the community, in her own community later on. So again, just getting her connected with the appropriate people ahead of time, because it's stressful enough at the best of times. So from there, those are my nursing judgments and goals. How do I know if they're being met? So is there an effective latch? Is the feedings going well? And is the baby gaining weight? And is the mom experiencing pain or not? So all of these things kind of measure up to the resolving candida and preparation for surgery, and supporting the mother-infant dyad in the breastfeeding experience. So from there, just opening the door and keeping the communication open so that she can come and get frequent weight checks and assessments and support throughout her pre-surgery and post-surgery experience. So I hope going through the situated clinical decision-making framework, applying it to candida and cleft lip has been helpful. If you have any questions, leave them in the comments below, or you can contact me through the D2L if you are one of my classmates. Thank you very much for watching. Good night.